Joyce, 5 minutes.
I'd like to thank Chairman Guthrie and Ranking Member Eshoo for holding this important hearing and to our panel for testifying. During the COVID-19 emergency, we saw the rapid expansion of virtual care service for Medicare beneficiaries. Many of these COVID-19 telehealth flexibilities that were extended in the Consolidated Appropriations Act of 2023 are set to expire at the end of this year. There is an especially pressing need to reauthorize waivers for patients in need of cardiopulmonary rehabilitation services. Currently, only rehab provided in physician offices, which is less than 5% of available programs, are covered under Medicare as part of telehealth extensions. The other 95% of cardiopulmonary rehab is provided as an outpatient service, coverage of which expired along with the public health emergency, and so seniors are left behind with very little access to virtual care. I appreciate that this subcommittee considered legislation that I introduced with Representative Scott Peters, H.R. 1406, the Sustainable Cardiopulmonary Rehabilitation Services in the Home Act, during a previous hearing focused on strengthening patient access to care in Medicare. As we consider the need to maintain virtual access to care, we shouldn't forget about access to services that are already lapsed. And I look forward to continuing to work to advance this important piece of legislation. There is a real need for these services. Cardiac rehab at home done through telehealth has been shown to reduce hospitalizations by approximately 30%. Dr. Schwann from the American Heart Association, how will increasing access to virtual services aid in uptake of these rehab services for Medicare beneficiaries?
Thank you so much for the question. I think what you're highlighting, once again, is an example of patients who need a repeated, high-frequency series of visits to achieve the best health outcomes. In those circumstances, the burden is disproportionately placed on those patients, particularly elder Americans who've had a stroke, an MS flare, a recent heart attack, and so the ability to provide services in the home with qualified, supervised individuals increases the access to the care. We're talking a lot in this room about the fear of overutilization, but we should also be talking about underutilization.
And to that point, can you speak how increased access to cardiopulmonary rehabilitation will ultimately improve overall health outcomes?
We know that cardiac rehab helps to prevent relapses and repeat hospitalizations after acute events.
Let's stay on that. So you say, and please repeat for this hearing, that there will be fewer rehospitalizations because of cardiopulmonary rehabilitation done virtually.
I don't know that I can provide evidence to you that virtual delivery of cardiopulmonary rehabilitation is as effective as in-person rehabilitation. I would have to check on that for you. But I can tell you it's way better than nothing, which is right now what most Americans who have a heart attack experience.
As we look at increased impact on Medicare and the resources, do you feel that the addition of extending the cardiopulmonary rehabilitation will ultimately allow cost savings to the Medicare system?
I do. I'll make a slight analogy. My car gets better health care than I do. It tells me when it's running low on gas. It tells me when the engine needs to be serviced. It tells me when I need a new spark plug. That happens for me as a person when I'm on the side of the road with steam coming out of my engine. I have a heart attack.
Well, then can telehealth be that vehicle? Can telehealth allow that vehicle to give us the warnings?
Move away from random episodic events of care to more of a continuous embrace of our patients, ensuring they adhere to our evidence-based therapies will ultimately lower costs.
Do you feel, Dr. Schwam, that payment stability of permanent Medicare coverage affect healthcare practitioners looking to build more on comprehensive telehealth services?
I've said it before, and I would reinforce that with an exclamation point. It's certainty of reimbursement that will drive innovation and adoption.
And I think American patients, I think our constituents realize that innovation is the cornerstone of American healthcare. And telehealth services are part of that innovation that Americans seek. Thank you. I think this virtual access is necessary because we do not have enough cardiac rehab centers, about 1 center per 100,000 adults. Improving access to this care will ultimately lead to better health outcomes and reduce costs to the Medicare system through reduced hospitalizations and reduced emergency visits. Mr. Chairman, I ask unanimous consent to include this letter from the American Association of Cardiovascular and Pulmonary Rehabilitation for the record. And thank you, and I yield.